Hi, I'm Senator John Cornyn of Texas. 8 years ago, the American people experienced the worst terrorist attacks in our history. On September the 11th, 2001, thousands of innocent people lost their lives in the fields of Pennsylvania and in the ruins of the Pentagon and the fallen towers of the World Trade Center. This year and every year, we honor those we lost on 9/11. And our hearts go out to all of those who remember that day as both a national tragedy and a personal tragedy. The terrorists who attacked us on 9/11 enjoyed safe haven in Afghanistan, and that's why winning in Afghanistan remains so important. The Afghan people, like the American people, are tired of war, but they do not want their country returned to the control of religious extremists, and neither do we. President Obama has renewed America's commitment to Afghanistan. He has the right civilian and military leadership in place. These leaders are developing a campaign plan based on the successful surge strategy that worked in Iraq. Our troops and their commanders in Iraq and Afghanistan deserve broad bipartisan support, and they will have it. Republicans will support the deployment of additional troops if requested by our commanders, as well as the resources our troops need to be successful as they attempt to deny safe haven to al-Qaeda. Republicans will not waver in our support for our forces in the field or President Obama as he fulfills his responsibilities as Commander-in-Chief to protect the American people. On Afghanistan, President Obama has shown the kind of leadership he promised during the campaign. He's built consensus and earned bipartisan support. Yet on health care reform, he's taken a much different approach. He's paid lip service to bipartisanship while rejecting the ideas that would build bipartisan support. As a result, the president has alienated not only independents and divided his own party, but Republicans as well, and he's ignored the clear wishes of the American people. So the president gave another big speech this week to try to turn his numbers around. But instead of talking, the president and congressional Democrats should spend a little more time listening. At town halls and public events across the nation, the American people are asking the right questions about health care reform. They're asking, how can Washington lower health care costs by spending trillions of dollars more over the next 10 years? How can Washington cut $500 billion from Medicare without reducing benefits for seniors? And how can a new government plan keep insurers honest when our existing entitlement programs are riddled with waste, fraud, and abuse? The president told us Wednesday night that, quote, there remains some significant details to be ironed out, close quote. He wasn't kidding. The most significant detail is the cost of his plan and its impact on our long-term budget deficit. When you start counting in 2013, the first full year of implementation, the cost of the House bill comes to about $2.4 trillion over 10 years, according to the Senate Budget Committee. So instead of a top-down plan that will bust the budget, President Obama should work with Republicans on a bottom-up solution that the American people can support. The Republicans want to save Medicare and Medicaid from bankruptcy by offering more choices to beneficiaries and making providers compete for their business. Republicans want to expand access and lower the costs of private insurance by expanding competition at the state level. Republicans also want common sense medical liability reform that eliminates junk lawsuits against doctors and hospitals. We need to put an end to jackpot justice and frivolous lawsuits, as well as the practice of defensive medicine. By listening to the American people and working across the aisle, President Obama can deliver common sense health care reforms that will lower costs and expand access to care. Thank you very much for listening. May God bless you and your family, and may God continue to bless the United States of America.